We often hear about heart attacks and strokes, but there's another serious condition that often lurks silently: abdominal aortic aneurysms, or AAAs. These silent threats can remain undetected for years, often until they rupture, becoming a life-threatening emergency. Understanding AAAs, their causes, symptoms, and treatments can be life-saving. Imagine a garden hose with a weak spot. Over time, the pressure of the water can cause that weak spot to bulge, and eventually, it might even burst. This is similar to what happens in an AAA. The aorta, our body's main blood vessel, develops a weakened area that balloons outward. Early detection and treatment can significantly reduce the risks associated with AAAs. Knowledge is power, and being informed is the first step towards a healthier life. To understand abdominal aortic aneurysms, we first need to understand the crucial role of the aorta. The aorta is like the body's main highway, a large, elastic blood vessel that carries oxygen-rich blood from the heart to the rest of the body. It originates from the heart, curves upward into the chest, known as the thoracic aorta, then travels down into the abdomen, called the abdominal aorta. Along its path, the aorta branches out into smaller arteries that deliver blood to vital organs like the brain, kidneys, and digestive system. Just like a well-maintained highway is essential for smooth transportation, a healthy aorta is crucial for efficient blood circulation. However, various factors can weaken the walls of the aorta, making it susceptible to aneurysms. Understanding the structure and function of this vital blood vessel is key to grasping the seriousness of AAAs and the importance of maintaining its health. An abdominal aortic aneurysm, or AAA, occurs when a section of the aorta in the abdomen weakens and bulges outward. Think of it as a balloon-like swelling in the wall of this vital artery. As blood flows through the aorta, pressure builds up in the weakened area, causing it to expand over time. AAAs are particularly dangerous because they often have no symptoms, especially in the early stages. This means the aneurysm can grow undetected for years, increasing the risk of rupture. A ruptured ABA is a life-threatening emergency that requires immediate medical attention. It can cause severe internal bleeding, leading to shock and even death if not treated promptly. Therefore, understanding the nature of AAAs and recognizing potential risk factors is crucial for early detection and prevention. Section 4. Unraveling the causes why aneurysms form. While the exact cause of abdominal aortic aneurysms is not always clear, several factors can contribute to their development. One of the most significant risk factors is age. AAAs are more common in people over the age of 65, suggesting that wear and tear on the aorta over time plays a role. Smoking is another major risk factor, significantly increasing the likelihood of developing an AAA. Smoking damages the walls of blood vessels, making them weaker and more prone to bulging. Other risk factors include high blood pressure. The constant force of blood against the artery walls can weaken them. High cholesterol, this can contribute to plaque buildup in arteries, restricting blood flow and increasing pressure. Family history, having a close relative with an AAA increases your risk. And genetics, certain genetic conditions can weaken the aorta, making it more susceptible to aneurysms. Understanding these risk factors can help individuals take proactive steps to reduce their chances of developing an AAA or detect it early. Section 5. Silent until it's not recognizing the symptoms. One of the most concerning aspects of abdominal aortic aneurysms is that they often don't cause noticeable symptoms, especially in the early stages. This silent nature makes regular screenings crucial, particularly for individuals with risk factors. However, as the aneurysm grows, some people may experience symptoms, including a pulsating sensation in the abdomen. This feeling, like a heartbeat in the stomach, can sometimes be felt even without touching the abdomen. Pain in the abdomen, back or side. This pain can range from dull and achy to sharp and severe. And a mass felt in the abdomen. While not always present, a large aneurysm might be felt as a pulsating lump. It's important to remember that these symptoms are not exclusive to ADAs and can be caused by other conditions. However, if you experience any of these symptoms, especially if you have risk factors for AAAs, it's vital to seek medical attention immediately. Section 6. Seeking treatment, options and importance of early detection. Treatment for an abdominal aortic aneurysm depends on its size, growth rate, and the patient's health. Small, slow-growing aneurysms may require watchful waiting with regular monitoring. Larger or rapidly growing aneurysms often need surgery to prevent rupture. Endovascular aneurysm repair, or EVAR, is a minimally invasive procedure using a stent graft. Early detection is key to successful treatment of AAAs. Screenings are recommended for men over 65 and those with a family history of AAAs. Early detection and treatment can make all the difference.